Hi everyone, welcome back to Best Face Forward. Today, I'm going to be talking about this right here. This is the appliance I'm using to try to bring my lower jaw forward to make more room for my tongue. Something that a lot of you may need to do. I'm going to explain exactly what this appliance does with the help of Dr. Estrabillo and what we're hoping to improve with this treatment. And please subscribe and toss a like on this video if you're enjoying this content. This is Dr. Roland Estrabillo. He's a holistic dentist who's owned his own practice for over 30 years. He's received training from experienced physiotherapists and myofunctional therapists and integrated it into his own practice. This series is going to be giving you guys an inside look at how he treats patients with poor posture, me being used as an example. I'm going to document my progress with him every step of the way. I am Ryan Blankers, and this is my mewing transformation.
If you look at Ryan right now, his ear is still pointing backwards this way. So that tells me that his head is rotated. The fact that his head is rotated back, automatically the jaw actually is rotated as well. That will make his back teeth touch more than the front teeth. The angle of the jaw, he's actually forced to open his jaw because his upper teeth and the back teeth are healing because of the rotation of the head.
What Dr. Estrabillo is talking about with my jaw is similar to an open bite. When the jaw is slanted backwards due to forward head posture, the back teeth tend to touch more than the front teeth. Since the bite is a fixed structure, what he explained to me is that this is why mewing by itself was not enough to fix this problem. This is confirmed by my bite analysis. What I'm showing you right now is called a T-scan, which measures the force of the bite on all of the teeth. You can see that mine is very focused on the back teeth, which further confirms what he was talking about.
So what we want to do is actually, we want to derotate the head as Licia and Ryan do their exercises to correct the forward head posture. But once the forward head posture is corrected, the back teeth are going to be freed up. Okay? So now what we want to do is we want to swing that jaw forward so that this long face height right here is going to get shortened and the angle of his jaw is going to actually get less teeth. Right now, that upper appliance is going to go, of course, on his upper teeth. The reason why I want to do that is because I want to make sure that those teeth do not super erupt. And then the bottom is going to go, of course, on the bottom.
Yeah.
And in that bottom, we're going to have an acrylic on the very back. Only the very last tooth. The reason for that is we'll use that as the fulcrum for the jaw to actually, when he does his teeth exercises, the condyle, the joint right here is going to open up.
So one thing to note with this appliance, as Dr. Estrabillo explained, it's raised a tiny bit only on the back molar. So what that does is it means that the only teeth that are making contact are going to be the back teeth. You can see that there's essentially a gap from all of the other teeth. The reason we're doing that is because we're trying to correct my bite so that when we remove the appliance in 3 weeks, what's going to happen is my bite is going to naturally adjust, which will make more room for my tongue and swing my jaw forward. See, right now, as Dr. Estrabillo explained, my back teeth are touching a lot more than my front teeth. By adding the little acrylic on the back teeth with this appliance, it essentially raises it up. Now what this is doing is it's forcing the muscles and the ligaments around my face to readjust to this new pattern.
The appliance that he's got right now is called distraction appliance. What that will do is when he eats with that thing, it will automatically do exactly what we want it to do.
And why will it do that? Why when I eat will it do that?
Because the forces that you're using to chew your food is enough to actually bring the jaw, the condyle down.
Okay.
The socket.
Wait, Did he just say that just by eating it will change my jawline? Yes, he did. And the reason is because of the condyle that he just talked about. The condyle is the head of the mandible, and it sits inside of the mandibular fossa, or what they call the disc. The slanted jaw and forward head posture cause this condyle to be too close to the disc in the back. By me chewing food with this appliance in, because the back teeth are raised, it will cause the condyle to separate from the disc ever so slightly just by me chewing. It essentially functions as a fulcrum where there's leverage that causes the condyle to be separated from the disc.
So when that happens, the jawline of Ryan is going to go this way and this way rather than being like this.
I'm excited to see if it works.
So that's what we want to do.
Yeah.
Okay? That will take about 3 to 4 weeks. Sometimes people take them about 5 to 6 weeks, but not very, very long. Then after that, it's going to have a contact right in front. These are the cuts that we just did. His contact is going to be mainly in front because the jaw on top is going to swing this way, and now that's going to be his contact. And by leaving that alone, the teeth are going to be this way. All of those teeth now will just find their way without doing anything.
The teeth will shift.
Yeah.
Okay, and let's talk about what will happen to the tongue position. Will it change the position of my tongue?
Well, now all of a sudden you have enough room. You could do more with your tongue. Because you just lowered this guy here, but you brought this up there. So now you have the tongue all of a sudden has got more space than what you had before.
I've been wearing this appliance for 1 week. I've been eating with it. I've been sleeping with it. I've been talking with it. What I wanted to say is that I already feel it working, which is quite exciting because I know it's going to work. See, when I take these out, I've gotten so used to having them in, my front teeth are touching. Because the back teeth are raised, it actually changes your bite. So what I notice is that when I take it out, my front teeth are touching like they haven't before in such a short period of time. So say this happens, then what are we going to do after?
Okay, we're still working on the airway, correct? So as the posture improves at the back, remember, it's all about getting all the muscles and the airway pattern. So as your airway improves, guess what? You'll be able to breathe through your nose better. You could, once you do more of these exercises, including the tongue, now the roof of your mouth will widen. That's more airway. The fact that your tongue could actually lift up even easier, and that's a fall back, that's more airway. The fact that your neck and your cervical vertebrae is going backwards, that's going to be more airway. Guess what? In the long run, what's going to happen, the net result is you're going to have a better breathing apparatus with your tongue in the proper position, with your neck in the proper position, and then guess what? These muscles are going to be happy, your jawline is going to be nicer, and your maxilla is going to spread.
Yeah. Dr. Estrabillo is trying to start working with patients online so he can reach more people. We are actually going to be choosing 10 to 20 people from this channel who are going to be able to work with him almost for free online so he can test out his ability to treat patients online. If you're interested in that, go into my description below and send me an email with photos of your face from the side and from the front so we can decide if you'd be an appropriate candidate. If you've been enjoying this content and want to see my further results, please subscribe, and thank you for watching.